Good afternoon, folks. Sorry we're a little late. We've been busy all day, the weather and quite a few other things, but we're here for our weekly update on COVID. And with me are my good friends and co-host, it seems like every couple of 3 weeks, Clay Horton from the Davis County and Green River Health Department, and Dr. DuFrayne from Owensboro Health. As always, I start the meeting wearing my mask just to show you how important it is. And we also start the meeting just for a moment of silence for those folks who have passed away from COVID or COVID-related complications. And let's just take a moment and remember them and their families. Thank you. Today, we've got a lot of territory to cover. The first thing I'm going to tell you is I'm pretty happy. For the first time, I think, since back in late October, we had a total of 18 COVID cases. This is in the middle of the week, Clay. We've been seeing low numbers on Mondays, but that's typical. But we haven't seen such low numbers on a Thursday. So if you would, so we can get right to you and Dr. DuFrayne, why don't you give us a little update on COVID and what's been happening here in our community? And why are our numbers trending lower now?
Well, thanks, Judge. And that is right. We've seen a steady decline in our COVID numbers for about 5 weeks now. So we knew we were moving in the right direction, and that trend continues on. I think you can blame a little bit of the good news this week on the weather. It's probably impaired some folks in getting out and getting tested. But looking at the trend that we were seeing the last several weeks, that's not the whole story. And perhaps maybe a few days at home with everybody having to lay low and slow down for a while, that may have sped our decline a little bit too, and that's certainly good news. But I think the bottom line is the reason we're seeing the numbers going down is because people are doing the right thing, and right now is not the time to let off of that. We need to continue to do the right thing. We need to continue to be smart. Our efforts are paying off. And we're not out of the woods yet, but you're right. This is probably in terms of the infection rate, the numbers that we're seeing in the community. This week I haven't felt this good in a long time in terms of that aspect. The snow and the ice has caused a little stress in some different aspects of our operation, but our case numbers are quite good.
Well, when I saw that, Clay, I have to admit I let out a yell and a yay-hoo, and because they are excellent numbers, because the number of positive cases, new cases that you have, and the number of hospitalizations that you have all are directly related to the number of deaths that we end up having. And certainly we don't want to see those folks any more than anybody else, but we don't want to see folks dying from a disease that really it's in their hands to prevent. I mean, they wear their masks, sanitize their hands, socially distance, and avoid large crowds, and they can prevent a lot of this. There are a lot of folks out there who have been doing that and who have successfully avoided. Now, quickly, tell me, do you think the vaccinations that we've been doing have helped? Because we vaccinated all those folks that wanted a vaccination at a nursing home or an assisted care living probably have gotten those vaccinations by now, would you say?
Yeah, so I think vaccines are part of the story. We haven't, as a society in general, we probably haven't vaccinated nearly enough people yet to breathe that sigh of relief. But one thing that we've really noticed, our mortality rates in long-term care facilities has really dropped off. And we're contributing a lot of that to the fact that they were the first in line to get the vaccines. And in Kentucky, probably a month, 6 weeks ago, all of our deaths were around 70%, or long-term care facility or congregate care setting deaths, mortalities were about 70% of the total mortality rate. It's down just a little over 50%, like 55% now. So we are seeing a shift. We are seeing a big change, and that certainly is good news.
If I remember my numbers right, the governor talked about 90% of the deaths occurred in those who are 70 and older, when you looked or accounted for all the deaths. And certainly we've been vaccinating our senior group, the 1B group for quite some time now. Well, Dr. DuFrayne, welcome. It's nice to always see your smiling face. Well, you were frowning, but now it's a smile.
No, it's a smile.
And
Yeah.
I think you have some good news for us, and we perhaps people will hear this first from you. So give us the big announcement that I just got a press release on.
So the big announcement is, can you hear me, Judge?
Yes, sir.
Yeah, good. So the big announcement is today we are opening up our vaccine clinic to the very beginning phases of Tier 1C, Plan 1C, which is all people from 60 to 69. And we are starting that as of today. So the schedule is already open. We released this about an hour ago, and I was just texted a little while ago and informed that we probably have about 200 people in line on the queue just trying to get scheduled. So the word got out there very quickly. So we're really following the state's lead on this. Commissioner Stack just put out a message in his weekly meeting that for areas where they're pretty much through 1B, and we've really hit the numbers hard, that they can start opening up to Plan 1C and really focus on the 60 to 69-year-olds. So that's open and ready to go. And I know they'll put it out on Facebook. I already spoke to the Messenger Inquirer. So the word's getting out there really quickly.
We're gonna, when this is over with, we're gonna post it on our Facebook. We get a lot of folks that are watching us here. I've had some friends down in Florida tell me that they come on and watch us, and I'm going, we're
Really?
famous everywhere. So
there you go.
You know, 1C also includes some essential workers, Clay, and are those going to kind of take a backseat to the 60 and older, or are they going to incorporate the essential workers along with the 60 to 69?
So I think we're kind of in a transition phase right now between 1B and 1C, and you know, really we want to try to still prioritize that 1B population, but as we're also trying to balance this goal of administering all of our vaccine or 90% of our vaccine within 7 days of receiving it, it just becomes a lot more practical to add a few more folks into that. And so as we transition from 1B to 1C, the decision has been made that we're going to put special emphasis on that 60 and above crowd. Everyone else in 1C will be the very next step. And I don't have an exact date for you, but I think it's going to be sooner than later. I think just ask our community to be patient, and I think that certainly in the next month or so, you'll see that transition.
I think originally we were talking about 1B starting around the 1st of February. They actually started middle of January. I don't think anybody thought 1C had hit till up into March somewhere. So now we're starting to see that. And I think that's a direct result also of the increase in vaccine that we get. A lot of folks are out there, they're upset that they can't get in, they can't get their vaccine, and I don't blame them. I'm 73 years old and have had both shots now, but it's a indirect relationship to the amount of vaccine we have. At the very beginning, I think the state, and I may be off a little bit, was getting roughly 54,000 doses a week to spread across the entire state, meaning 120 counties, roughly 400, or I don't know, probably the health departments, other sites, regional health centers. And so there wasn't a lot to go around. My understanding now is we're getting about 88, 89,000. So we've seen a 60% increase in the number of vaccines that we're getting in. And I think it's good in some respects because it's allowed folks like the health department, Owensboro Health, and other folks who are distributing the vaccine and giving it, it's allowed them to ramp their system up. So it's not just chaos. So it's good news, Dr. DuFrayne, good news, Clay, on what's going on in our county. So let's get right into the questions. Very first question, and we've had this several times, Dr. DuFrayne.
Yep.
If I've been vaccinated for COVID-19 and later become exposed to the virus, do I have to quarantine? And if I have to quarantine, how long do I need to be isolated? What if I've only had one shot instead of two? So that's a multiple part question. So if I've had both shots and I've had them for a couple weeks, 3 weeks, and I'm exposed to somebody with COVID, and we know they have COVID, do I have to quarantine?
No, that's the short answer. I can go into it a little bit. So as long as you get both shots, and then 14 days after your second shot, if you're exposed to COVID, you do not have to quarantine. And so that goes from day 14 to day 90.
Okay.
So at day 90, we'll have to address it at that time because we just don't know how long the vaccine is going to work. So right now, CDC has put out day 14 to day 90. If you gotten both shots, if you receive both shots, you do not have to quarantine. So that's great news.
Well, if I've only had one shot, yeah.
Right. So that's always the curveball here. If you only had one shot, we don't really believe that you're fully vaccinated. And if you're not fully vaccinated, you've gotten the one shot, haven't gotten the second shot yet, and it's not 14 days, you do have to quarantine.
Okay.
And that
Clay, kind of continuing along that line. So if I've got both shots and I'm exposed, can I still spread it?
We don't know yet. So there have been a couple of studies that are promising that looks like that perhaps the vaccine does effectively stop people becoming infectious. But the early studies, the data that was put out initially looked specifically were the vaccine safe, and did they effectively stop illness? And they were very effective at that. Since that time, there's been some more data published that shows that perhaps it's also effective in preventing people becoming infectious. I think that's one of the reasons you saw CDC, I guess it was last week, all my weeks are running together, come out with their recommendations on, not having to quarantine if you're in that window of time between 2 weeks and 12 weeks past the second vaccination. But time will tell. And we look forward to that. And so, and Dr. DuFrayne explained the CDC guidance very well. I just want to, and he said this, but I just want to reemphasize the point that recommendation doesn't mean that the vaccine is no longer effective after 90 days. We just don't have good data yet. So that was kind of a cautious approach on the CDC part.
Okay. So,
and Judge, if I can have one thing.
Please. Yes.
And you've already demonstrated it. So even though you get your vaccine and you're 2 weeks out, we still recommend that you wear a mask because we don't know. So I've already received my second dose. I'm 14 days out. Everywhere I go, I still practice wearing my mask, social distancing, washing my hands. And we'll continue to do that until we get really good data that says we're all free and clear. We're just not there yet.
Well, here's a question. So we know that the Moderna and Pfizer are roughly 95% effective, a lot better than flu vaccine.
Mm-hmm.
How do I know that if I get both shots that I'm still not going to get COVID? Either one of you.
Yeah, well, actually, you don't know because it's 95%. So that means 5 out of 100 people can still get infected. And that's why we still take all the precautions.
That was the point I was making. Yep. That's why we want to continue to do it. And if I should get it, by wearing that mask, I'm keeping from spreading it to some of my loved ones, some of my family, and folks like that. So
now, where we will really benefit is when the majority of our population is vaccinated. Then that 5% continues to improve because I just know everybody around me is vaccinated.
Right.
So now the virus is really disappearing. We're just not there.
Okay. If I have both shots, and if I should come down with COVID, do the 2 shots offer me some protection from getting a really serious infection? By that, some people are asymptomatic. They don't show any symptoms. Some have moderate symptoms, flu-like symptoms. Some end up in the hospital. Is there any data that shows that even if I'm not 100% protected, do I get some protection from ending up in the hospital in intensive care?
So yes, there actually is very good data that shows that by taking the vaccine, even if you're exposed and you happen to become infected, first of all, your viral load is much, much smaller. We do know that. And most people will either have mild cold-like symptoms to what you were saying to actually being asymptomatic. So yes, the vaccine, that's really the point of the vaccine right now, is that it really lessens the effect of the infection.
Okay. So real quick, Clay, I've got a couple of questions that weren't on the list, but I think we will address them. What about people that are not 60 to 69, but are at high risk? So what do they do? That's kind of like I think we've had some high risk that already could get it, probably if their doctor had made that recommendation. I'm not sure. But then I've got another one to follow up. It says, I've been waiting for the opening of Group 1C so I could sign up. I'm immunosuppressed because of a transplant. I don't understand why health impaired are not allowed to sign up since 1C is being opened.
So, you know, as we said earlier, 1C, we're kind of in this transition phase between 1B and 1C. On any given vaccine site, you know, we are being asked to prioritize 1B. That's still our top priority. But in order to balance out the need to get vaccine out as quickly as we can, if when needed, we'll move to 1C with a special emphasis for those that are over 60. The bottom line is that there's not enough vaccine for everybody that wants it right now. And that's really kind of been the story since mid-December, but we're getting there. We're making tremendous progress, not only in the state of Kentucky, but across the nation. And what I would say to that individual is we want to get that vaccine to them just as quickly as they want to get it. We ask them to stay informed, watch the phases, and wait for that opportunity. It is coming sooner than later.
I do know that there are some, as a matter of fact, some of the Walgreens, some of the pharmacies that are distributing the vaccine on occasion thaw out too much vaccine or have people who have signed up and don't show up. And I don't know, but you probably have had that issue. And I'm sure the Owensboro Health has had that issue. Is there a waiting list where somebody like this could go sign up and then if there is an opening, get a call?
Sure, they can sign up on our waiting list on the website now. I will tell you, our language on there is still referring to the 70 plus for 1B and prioritizing 60 and above for the 1C. Our waiting list is growing all the time. So what I would say is if you're on our waiting list, please be patient, but also be aware of other opportunities that come in the community because more and more providers are coming online all of the time. And, you know, and Owensboro Health is the real workhorse in the community in terms of providing this vaccine. They've just done a tremendous job in terms of the volume and the efficiency that they're able to roll it out. And they're, everybody should be appreciative of that asset that we have here.
Okay. Dr. DuFrayne, next week, believe it or not, I'm going to have Secretary Jim Gray on, the czar of, the czar of all vaccination sites throughout the Commonwealth. I've known Mayor Gray for a long time, and now the secretary. He's doing a heck of a good job as far as Secretary of Transportation, and I think he's doing a great job working with these vaccine sites. There has been some talk about opening mega sites, drive-through sites, and all those kinds of things. I've been waiting for one to open in Davis County. Haven't heard anything. I continue to hear, well, you've got a mega site in Owensboro Health, and I think that's true. What would you say to that?
I would say I think that's true also. We've been waiting to see if they're going to have a mega site come through here, a drive-through site, and we really haven't heard anything yet. We started a vaccination program on December 24th, and so far we've vaccinated 25,000 people, 16 first time and 9,000 follow-up second time. So we've really been able to handle it, and our limiting factor right now is the number of vaccines we get every week. So we get a weekly shipment, and the more that the state is able to give us, the more we get out that week. And that is our goal, that by the end of the week that we get it, those vaccines are already distributed. So
I think the governor and Dr. Stack have been talking in terms of they want 90% of it in the door and out the door. And one of the things I would like folks to understand, and you guys can correct me if I'm wrong, but I anecdotally, I continue to hear about 45-year-olds who got their shot. Folks like this person who has some health issues got their shot. that typically is because some of these sites are doing exactly what I said. They have the vaccine sitting there. They don't want it. They're not going to allow it to go to waste. Not one dose is going to go to waste, and they'll open it up. And that's how sometimes people who are outside of 1A, 1B, and 1C would get those vaccines. You know, is it fair? I don't know that it's fair. It's just the roll of the dice, and I don't know. We're certainly not going to waste the vaccine.
Correct. And also, so I'm going to say for a lot of the sites early on, I mean, we did that the first week or two. We would have 3 or 4 shots at the end of the day, and we would actually walk through the hospital and just, you know, speak to the staff. Did you get your vaccine yet? No. Okay, downstairs. So they would get but within about 2 weeks, we learned really to calculate it much better. And now by the end of the day, we have no extra doses. So I think early on, yes, there were probably some people who were out of the phases that got their shot, but I'm going to say that number is really decreasing. We figured out how to do it.
So, Clay, if I had COVID already, I had it last year, back in June or July, I had it. Is there any reason I need to get that shot?
Yes. So the data suggests that the immunity that you get from the vaccine is probably stronger than your natural immunity from being infected. Now, if you've been recently infected, certainly if you're currently infected, you want to delay getting vaccinated. You don't want to get vaccinated while you're still sick. You want to be completely released from isolation and well. The CDC does say that if you've been infected in the last 90 days, that you may consider delaying. It's not required that you do. But again, we would encourage everyone to get vaccinated. If you were infected recently, you may want to wait a little bit. But beyond that 90 days, there's absolutely no reason to defer.
Okay.
And also, if I can add to that,
yes, sir.
So if you know you had COVID, and there are some medical treatments that we can give you. So now we give the monoclonal antibody. So if you meet certain criteria, anybody 65 or above, and then other people with certain conditions, we can arrange for an outpatient infusion. It takes about 3 hours to receive this antibody. And we've had a very good response to it. But if you've gotten the antibody, and they're either, the short name of one of them is BAM, and the other one is Regeneron. If you've gotten those antibodies, we strongly recommend that you wait the 90 days, because the antibody can still be circulating, and it'll really lessen your response to the vaccine, and we don't want that. So, and then if you're in the hospital and you receive any of the other treatments, we also, again, recommend that you wait. So if you've had it and received no treatment, you can wait 90 days, and we recommend that, like Clay said. But if you've received any of the treatments, we strongly recommend that you wait, because we want the vaccine to be effective.
I've heard really good results regarding the antibody infusion. But the one thing I've heard and read is that you really need to get there quick. So don't lay at home sick for a week or two before you get help. The sooner that you can get in, the sooner that you would receive that treatment, the better result that we're going to have. I just had a shingles shot, and now I got a call the next day to get my COVID shot, and I'm told you can't do that. What's going on there? That's to you, Dr. DuFrayne. Yes.
Oh, thank you. No, thank you, Judge. Yeah. So what we don't want to do is give you 2 vaccines at the same time, because your response can really be affected by doing that. So we really give you a vaccine and let you respond to it. And then we wait a period of time, depending on the vaccine, and then give you the next vaccine, so that your body has ample opportunity to really respond. And like I said before, that's what you want. It also goes along with, when you talk about things like early on, it was recommended that before you get the shot, on your way to the shot, take your Tylenol or your Advil. We now know to please do not do that. And it's a theoretical concern, and we're not sure, but we don't want to affect your response. So we now recommend that you don't take anything prior to the shot, and you wait around 12 hours if you can. If you start to have any side effects, then you can take your Advil, your Motrin if you're not allergic to it, or if you can take it, or your Tylenol, and that'll help you to sleep through the night. And typically by the next day, people are better. So hold off on taking that as long as possible.
Okay.
Yeah,
Here's
Judge,
a question.
I think the
Go
waiting,
ahead.
I
Go
guess
ahead,
the
Clark.
waiting period after the shingle shot, I think, is 14 days. And I'll tell
Yeah.
you, I only know that because I overheard that question being asked of our nurse supervisor Saturday when we were doing our drive-through clip. So
Okay.
I wasn't prepared, but I just happened to have heard that answer this past weekend.
I happened to see that question or a statement from someone who was kind of upset because they weren't told that you can't have both of them. And when they got there, they were questioned, and they said yes. And so they had to delay getting their COVID shot, which they could have let the shingle shot go for a while. But So Dr. DuFrayne, just a little technical question, and not Clay, I'll ask you, you can chime in if you want, but I've been reading some studies talk in terms of folks who have another viral infection. Let's say I have the flu, the regular flu, that I am less likely to catch COVID while I'm being infected. Have you read any studies regarding that? And I'm only saying that, and folks, don't go out and try to get infected with the flu or some other virus to avoid all this trouble, but it's just for my own information.
So there are not great ongoing active studies. They're really what are called observational studies. So we have seen that people who've had the flu, the percentage of those people who actually have contacted COVID at the same time or around the same time is much lower. And we think it's because with the flu, your immune system is already ramped up. So you're already in the midst of a very strong immune response, and that seems to be protective. So yes, it actually can help.
Okay. Clay, how long, and I think we've already talked about it, how long do I have protection from a COVID vaccine? I think we've talked about this in the past and even talked about it earlier.
Yeah, so the CDC put this 90-day time frame in terms of folks that didn't have to quarantine, but that's based just on what we know now. We really don't know how long that protection is going to be at this point. The signs are encouraging though, but we will learn more as we go.
Okay. Dr. DuFrayne, go ahead.
I was going to say, and I agree with Clay. I mean, 90 days right now, and if it were just the one COVID with no variants, I think this would be a very protective. The real concern now is what's happening when we add all these other variants. And we're really starting to believe that we probably will need booster shots.
Okay. So just quickly, when you say variant, another term is a mutation of the virus, just a slight change, just a little change that typically it can do a lot of things. We like variants sometimes in viruses because they go from becoming very infectious to being innocuous, just don't do anything. But it appears that the variants that we're seeing right now are increasing the infection rates. They're a little more virulent. I have noticed today, I got a notice that they had found 4 of I think the English or Great Britain variant in Northern Kentucky. It's just a matter, I think, before we see all the variants here as well. Maybe not as much as you would see in New York or in California, down in Florida, but eventually it's going to be here. You're going to have a mix, I would think.
And I agree with that. And then go back to what you're talking about, mutations. So viruses and bacteria mutate all the time. And it's just minor little changes. And for the most part, they don't mean anything. But it can mutate in a certain way that makes it much more potent, much more virulent. And that's what you're seeing now out of the UK, out of South Africa. Those variants are coming out. They've identified a lot more mutations, but they just don't mean anything. So it just depends on where the mutation is.
Right. And let's just be clear, all viruses mutate. So all they mutate, and it's not anything to get upset about, get scared, hide your head and put your head in the ground. Continue to do the things we're doing, mask, sanitizing hands, social distancing, and all the things that we've been doing for practically a year now. Clay, tell me, wasn't it next month, about the middle of next month, we had our first case?
For our area, it was March 19th. So yeah,
Well,
we're coming up on it.
Yep.
seems like it was forever ago, doesn't it? Forever ago.
Some
It
ways,
does.
yes.
And you know,
Seems like yesterday.
guys, it seems like what we were told is pretty much the way it's gone. It'll go up and come back down and peak, and the next peak is higher, and then down a little bit, and then the next peak higher, and it pretty much has done exactly. And when we got into the Halloween, Thanksgiving, Christmas, and New Year's, how soon will we know what the Super Bowl did to us? It's been 10, 11 days ago. We ought to start seeing it if it's going to hurt us that bad, aren't we?
We at the hospital, we've been noticing about 14 days. 14 days, we'll start to see a spike in admissions.
Okay.
And we've not seen it yet. So to go along with what you were saying early on in the broadcast, the numbers are going down in the county, which is great, but the numbers have gone down significantly at the hospital.
Right.
So we were peaking at about 50 admissions, 50 people in the hospital at any one time, and that was about 4 or 5 weeks ago. Now we're in the teens. We got down as low as 12 earlier in the week. So we are mirroring what's happening out in the county, and that's great.
Good. Well, Clay, I know that, one of the things that I continue to look at are the number of active cases. So that's the number of cases that were confirmed as COVID cases, minus the number of cases that recovered, and minus the deaths, and that gives you active cases. And there for 2 or 3 weeks, we continue to see it climb. I think we peaked somewhere around 1,900 active cases in any one day. And I know you and I had talked about that and said probably the active cases are 3-4 times higher than that number. But now I'm really seeing a decline in the number of active cases as well. I think today it's probably down around 1,300, which is good news. So Clay, tell me, crystal ball, right?
I don't have one of those, Judge.
Crystal ball. When do you expect the bulk of Davis County residents to be vaccinated?
I think it's a good question, and I think there's a couple of variables that'll go into that we have to look at there. And so I think you can either ask that question from one or two perspectives. One is when do we have enough of the community vaccinated that we get this herd immunity that they're all looking for, and then the other is when is enough vaccine going to be available for everyone who wants it. So I was talking to a colleague with the state health department yesterday that was kind of looking at what they were projecting in terms of their shipments coming into the state of vaccine. And he walked me through his calculations, and really we're probably looking June-ish for the state receiving enough vaccine to get everyone who's currently eligible or not really eligible, that's an adult to be vaccinated. The question is do we get all of those? Does everyone want to get vaccinated? And
Right.
so that's going to be the factor that we don't know. So probably in the spring, late spring, everyone who wants to get it will be able to. And then the challenge changes a little bit, and then we have to work and kind of build that confidence in the vaccine from those that are a little hesitant at the start. That's so depending on which way you're asking that question.
Sure.
So we're 4.5 months. That doesn't seem like a long time in my world. So we're getting there.
It really does not seem that long. A question for you, or Dr. DuFrayne. It seems to me that some of those folks that I've talked to in the past have changed their minds as to whether or not they're going to get the vaccine. There were a lot of hesitancy at the beginning. I've not been hesitant about vaccines all my life, and when my kid, it was time for him to get vaccinated against all those childhood diseases, we took him in. I have great confidence in our research and medical profession, but there are some who just have had a bad experience or have heard anecdotal instances of vaccines causing problems. But it really seems to me that I've noticed a change in mindset in our community, if not in the entire Commonwealth. What do you think?
I think that's true. I think we've noticed that as well. Once people know friends and family that got vaccinated and they did
Right.
okay.
Right.
I think that's built confidence, and that's the direction we're going. Right now, we've been kind of preoccupied with the demand issue and trying to appease, trying to reassure people that the vaccine is coming and that the systems are being built to distribute that, and then as we can get enough supply available to accommodate everyone. But really, the hard public health work's to come. And making sure that people understand that it is safe and it's effective and why it's in their benefit to get vaccinated.
Right. Dr. DuFrayne, and I missed the question here, and I will let you answer, and then I'm going to tell people what Judy and I experienced from our vaccination. What are some of the side effects, the predominant side effects that folks are experiencing, if any, when they get their vaccine?
So probably the most common side effect is a little bit of pain at the injection site. So when I got my first injection, I had some pain at the injection site. I didn't really need to take anything for it. It just, when I moved my arm, it was a little sore. By the next day, it was fine. Same thing on the second shot. But some people will have mild symptoms. They'll have some muscle aches, they'll have a headache, and those are probably the more common. And it's in that situation where we say, 12 hours after your vaccine, if those symptoms are starting to come on, then take a medication, take a Tylenol or a Motrin. So our response, the feedback we've gotten from the people we've given, a lot of people we've given the vaccine to, is they've tolerated it very well.
Okay. Judy and I, the early in January had our first shot. I was like you, I didn't even notice any pain until the next morning. I leaned up against the door frame and I go, I wonder why my arm is hurting. So, it was nothing more than when you get a shot of penicillin or anything. Judy, on the other hand, had a little swelling at the site. She asked me, she said, look, my arm has swelled a little bit. And I was telling somebody later, and they said, oh, she got COVID arm. I don't know what COVID arm is, but I guess it just means a little swelling at the site. Second shot, about 4 weeks later, Judy had no reaction whatsoever. Little soreness again. Me, on the other hand, after 24 hours, I felt fine, drove to Louisville the next day. After 24 hours, though, I came home, sat down in an easy chair, and I go, man, I'm a little achy and a little stopped up. Fell asleep, woke up the next morning, and I was fine. I mean, it was like for 8 hours, a little discomfort and nothing that was any worse than a head cold. But it affects people differently. And
yes.
my understanding is when you have those effects, though, a lot of times it's your body building those antibodies, building and boosting your immune system. So it's not a bad thing that's happening. So
yes. So you made a couple good points. One, it's not a bad thing. It shows that you're having a very good immune response to it. So that's a good thing. So that's one. And two, you are more likely to have a side effect after the second shot than you are after the first shot. So your reaction is more common after the second shot. And even the symptoms you got are really the common symptoms. You can't put your finger on it. It's just, I just don't feel good. I just, let me get a good night's sleep and I'll be fine. And you wake up the next day and you're fine. So that's pretty much the typical reaction.
So we talked a little bit about it, Clay. One of our last questions is, what's brought our cases down? And you've given a pretty good explanation. But, we have a couple of large facilities. We have a jail that has 699 folks, the capacity. We have a regional recovery that has 100 folks. We have several pretty large facilities that help people who are struggling with homelessness. We were very fortunate in Davis County in that we were able to keep COVID out of our jail until about December. And then it seemed like we had a run through in December. We got that under control. And again, toward the end of January, another outbreak. So each of those outbreaks was about 45 or 50 cases that got added into the total. And then at our regional recovery, I understand that we had a fairly good outbreak. So I think in that question is what's bringing our numbers down, but is the fact that we have gotten those outbreaks in these rather large institutions helped a lot.
So they have, and I think I mentioned earlier that in the state of Kentucky, we've seen a decline. I think I said the district declined for like 5 weeks. The state's seen that about 6 weeks. And 2 or 3 weeks ago, I kept getting the question from different folks about why are our numbers not improving like the states were.
Mm-hmm.
And my response was they are. They're just not quite doing it as quickly. And we started a little higher in terms of where we peaked than the state did overall. And we came down a little slower. We had, as you mentioned, a couple institutional type outbreaks. They didn't really stop our decline, but they slowed us down a little bit. And anytime you have these high rates in the community, you're at risk of something like that happening. You know, it increases your likelihood of the virus getting into a setting like that. And when it gets into a setting like that, it spreads very easily. So you see these spikes. But overall, the reason our rates are coming down is because people are doing what they need to be doing. So there's probably some degree to the fact that enough people have been infected at this point that there's some at least short-term immunity. We're getting some impact from vaccines. But overall, it's because we're wearing our mask, we're social distancing, we're washing our hands, and we're being smart. And we need to keep doing those things.
And I think, Clay, a lot of that's being driven at the very beginning. Remember, you had people. Do you even know anybody that's had COVID? Do you know anybody who's died from COVID? And I don't think anybody in this community today can answer no to any of those questions. And I think once people start seeing that, they go, hey, maybe Dr. DuFrayne, maybe Clay Horton are smart and we should follow their advice. And I think you're right. And I think kudos. We need to tip our cap to our community for doing that. You know, 46% of the population of your district, health district, is right here in Davis County. And for the longest time, Davis County's numbers were under that percentage, but we caught up. All of a sudden, we started showing lots more. There for the longest time, we were about less than 46% of the total cases in the district. And then for a long time, we were more than 46% of the cases in the district. And part of that, again, I think, in answer to some people who have asked that question, part of that is that we have some larger institutions where an outbreak is more likely and where it's harder to get it under control.
Whoops. Yes, that's correct. And the other thing, though, is if you look at these trends over time, and I've demonstrated this to some folks a few times, but you can look at our infection rates statewide. You can look at them in a district, and you can look at them even on a county level for a county large enough as Davis County. And the general trend lines follow the same. Yeah. There are times Davis County is slightly higher than the state average. There's times that they're slightly under. But if you look at that epidemic curve going back from March to now, the lines look very similar to each other.
Yeah, and mirrors pretty close. The Dr. DuFrayne just had a question pop up. Mm-hmm. Have you seen any allergic reactions, either at Owensboro Health or Clay, you at the health department, any allergic reactions to the vaccine? I have some person that has asked, should I bring my EpiPen with me?
So first of all, there are 2 types of allergic reactions. There is the more severe called anaphylaxis, and we have had no cases of that. There are probably, and we don't truly know because it's so early, we're not even sure what an allergic reaction is to the COVID shot. But we've had a couple people who probably had some type of allergic reaction, but it was mild. They didn't have to do anything. It resolved fairly quickly and went away. One of the criteria for actually distributing the vaccine is that you have to already have a setup in place where you have your epinephrine, you have your Benadryl. So wherever you get your shot will already have that. You know, it's up to you whether you want to bring your EpiPen or not, but the site's going to use their own.
You know, it's a good point. We, when we got our second shot, we marched through, we followed the yellow brick road
Yep.
into the auditorium, and we sat for 15 minutes, and there were people from Owensboro Health up at the front of there. I guess they were watching us for any reactions and all those kinds of things. So, Clay, if you go on Kentucky COVID-19.ky.gov, a wonderful interactive map that I follow every day. And here lately, it's been really great to look at, because there for probably 3, 4, or 5 weeks, it was nothing but red, meaning that we had more than 25 cases per 100,000 population. And that was true of all the counties. Some counties I saw got up as high as 200 cases. Davis County, at one time, I think 1 or 2 days, we had hit 105 cases per 100,000. Then we started trending back down. We're down in the 30s, 30-ish, somewhere in there, I think.
I think we were 25.5 yesterday. So
okay, so I had looked at it today. So that's that is really great after being at 105. The state, though, has been leading that trend down, because they were under 30 the last time I looked at the state. And this past time when I looked, I think we had 50% of the counties who were in the orange or yellow. And that's a wonderful thing after being in the red for so long. So last question for you guys, unless something else comes in. What do you recommend on travel? Can people take their vacations, lay on the beach, drink beer, eat oysters and crab cakes and with no worries, or do we hang around for a while longer?
Well, from the public health perspective, I haven't had to caution anybody about raw oysters for over a year now. So since you bring the issue, probably cook your oysters. So I would say this, and Dr. DuFrayne can chime in. I think that if you're going to travel, you still need to take all the precautions that you're doing here. I think officially the state still has an advisory against leisure travel, but that's been in place since early December. The landscape is changing some. But what I would encourage you to do is do your research before you travel and make sure you know what you're getting into. That goes in terms of not only what the infection rate is in your destination, but a lot of destinations now have COVID restrictions and travel restrictions. They have requirements that you have to fulfill. Certainly for traveling internationally, that's going to come into play. So you want to check the CDC's travel site. I heard a story this morning. I haven't researched it enough to know that it was true, but a group traveled from Kentucky to Hawaii over the weekend so the couple could renew their wedding vows. They had a big group. Hawaii is requiring that you get a COVID tested 3 days prior to travel. And a few people in the group hadn't gone to the right kind of lab. So they got put into quarantine. And then as soon as a flight was available back home, they got put back on a flight home. So don't run your vacation, do your research, make sure you know what you're getting into, and follow all of those steps.
Dr. DuFrayne.
I'm going to say, Clay did a great job. He really explained everything that you really need to do. And I think it really just comes down to some common sense. So, yeah, don't go to an area where you're going to be hanging out in large crowds and people are without masks and doing all those things. But yeah, if you do your homework and you're really cautious and you go to a place that doesn't have a high rate and it has all the proper precautions in place, then I think you'd be okay.
It's funny you talk about that. Judy and I had planned a trip. We got to talking about it. What if they change the rules while you're there? And we decided not to go. And lo and behold, they changed the rules.
Yes.
And it would not have been a very nice vacation if we had gone. So, let's go another 3, 4, 5 months. I think we can actually see the light at the end of the tunnel. Let's not give up. I have heard Mayor Watson say this. We're at the end of the game, and we can win this game. So let's not give up. And I think that's what we need to do. I want to thank both of you as always. You bring a wealth of knowledge and information to this. I would encourage the folks that want to talk about vaccination sites and the availability of vaccine to be here next Wednesday. when Secretary Jim Gray, the czar of vaccines, will be with us. I might even ask him a question about transportation and why your street or highway didn't get snow plowed off. So thank you guys for being here. Thank you folks for joining in, and everybody have a good week.
Thank you, Judge.
Thank you, Judge.
Thank you, Doctor.